It's 11 p.m. Your phone buzzes, the lab results from this morning have landed in your patient portal, hours before your doctor has even seen them. You scroll down and there it is, one little value, flagged in red, sitting there like a verdict. Your stomach drops, and before you've taken a breath, you've typed it into Google and you're 3 articles deep into the worst case scenario. G'day team, and welcome back to Overheard in the Emergency Room. I'm Dr. Cois, emergency physician and evidence nerd. If that 11 p.m. spiral sounds familiar, you are in exactly the right place. Because today I'm giving you the framework doctors use to read a lab report. Not how to diagnose yourself, that's not the goal, but how to look at your own results without spiraling and how to know which numbers actually deserve your attention. This is the home base for the whole Lab Results Explained series. Every test-specific video, cholesterol, A1C, thyroid, all of them, builds on the thinking we set up right here. So subscribe, because this is the one that makes all the others make sense. Let's get into it. We live in the patient portal era, and that's mostly a wonderful thing. You own your data now, but there's a catch nobody designed for. Your results reach you before the context does. You see the flag before your doctor has had a chance to tell you it doesn't mean what you think it means. So you fill the gap with Dr. Google, and Dr. Google has one bedside manner: catastrophe. I see the downstream of this every week. People who are genuinely frightened over a number that is, medically speaking, completely fine. And occasionally the reverse, people who shrug off something that actually mattered because it wasn't flagged in a scary color. The fix is not to stop looking at your results. The fix is to look at them the way a clinician does. And that comes down to a handful of ideas that, once you understand them, take most of the fear out of the page. So idea 1, a normal range is not the border between healthy and sick, because here's how reference ranges are actually built. The lab takes a large group of healthy people, measures them, and defines normal as the middle 95% of those results. And just sit with that for a second, because it's a wild consequence. By definition, 5% of perfectly healthy people, that's 1 in 20 people, will fall outside that range on any given test. And they're not sick. That's just what the middle 95% means. So now run the math on a typical panel. If your blood work includes, say, 20 different tests, then even if you are perfectly healthy, the odds are that you will have at least one of those tests that will come back as being flagged. A red flag on one value out of many is not a diagnosis. Very often it is simply statistics doing exactly what statistics do. Idea 2, being flagged is not the same as being sick, and the magnitude matters. There is a world of difference between a value that is a hair outside the range and one that is wildly off. A liver enzyme that's a few points high after you went hard at the gym yesterday is a very different story from one that's 10 times the upper limit. The color of the flag is the same. It's red, regardless of the number. The meaning is not, though. So before you panic, look how far out it really is. Idea 3, trends beat snapshots. A single result is a photograph. Your health is a movie. One slightly elevated reading tells a doctor far less than the same test measured 3 times over a year. Is it stable? Is it climbing? Is it drifting back to normal? That direction of travel is often the entire story, and it's invisible if you're staring at one number in isolation at 11 p.m. Idea number 4, and this is the one I want you to tattoo on your brain. A test should serve a clinical question. A good test is ordered because there is a specific question to answer. Why was this actually drawn? What was my doctor actually looking for? A result only means something in the context of the question it was meant to answer. A number with no question attached is not information. It is just noise that happens to be measurable. This is exactly why I'm not a fan of ordering yourself a giant panel of 100 biomarkers just to check. You'll generate a fistful of red flags. Almost all of them will be meaningless, and a great deal of anxiety will come across your life. And you'll have answered no real question at all. A few quick things that throw results off and send people into needless panic. Timing and prep. Were you fasted when you were supposed to be? Were you dehydrated? Did you have a hard workout? Did you have a big meal? Even the time of day can nudge values meaningfully. Biological variation and lab error happen. Bodies fluctuate, and occasionally a sample is just off. That's why doctors often repeat a borderline result rather than act on it. The incidental finding will cascade. One borderline number leads to another test, which leads to a scan, which finds something unrelated and harmless that now needs explaining. A stressful, expensive snowball that often started with a test that nobody ever needed. And finally, the simplest one, your doctor is reading the same report with years of training and your whole history in front of them. The portal gives you the number. Your clinician gives it the meaning. So next time a result lands at 11 p.m., run the framework before you run into Google. Remember that 1 in 20 healthy people will flag as being abnormal on a test. Ask how far out of range is it really? Look for the trend, not the snapshot. And ask the question that diffuses almost everything. What was this test actually trying to answer? The person who turns a page of numbers into actual meaning is your primary care provider, and who knows your history best. That relationship is the single most valuable thing in this whole conversation. It's the difference between a scary number and an answered question. A portal can hand you data. Only a clinician who knows you can hand you context. If you don't have that person yet, find them today. It's the highest leverage move you can make for your health. So that's the framework. If it took even a little of the fear out of that red flag, do me a favor. Hit subscribe and hit the notification bell, because the rest of the series takes the tests you actually get and walks through them one by one. Drop a comment with the result that's been worrying you and I'll prioritize it. The next video is the big one everybody asks about, your cholesterol numbers. LDL, HDL, triglycerides, ApoB. And it will all be explained in plain English. And the companion guide for this episode can be found at drcois.com, so head over and check out the blog post. I'm Dr. Cois. Let's chase less bad days and more good decades together. I'll see you next time, and hopefully not in my emergency department.